Waking up with a dry mouth after 60 is not normal. And more importantly, it's not random. In fact, it can be linked to medications, sleep disorders, and even early signs of high blood sugar, and most people miss it completely. So here's a quick question. How many mornings this week did you wake up feeling dry? 1, 3, every day? Because if it's happening consistently, your body is trying to tell you something. And today we're going to decode it, step by step. Most people think dry mouth is just dehydration, something simple, something harmless. But here's the truth. Your saliva is not just moisture, it protects your teeth, balances bacteria, supports digestion from the very first bite. When it drops, everything shifts. This is bigger than discomfort. Action. Stop treating dry mouth as normal aging. Start tracking when it happens. Here's something most people don't realize. Over 400 medications can cause dry mouth. Blood pressure pills, allergy medications, antidepressants, even sleep aids. They don't just treat symptoms, they quietly reduce saliva production. And when combined, the effect multiplies. Make no mistake about it, this adds up fast. Write down every medication you take. Ask your doctor one question. Could any of these be causing dry mouth at night? Imagine this. You're sleeping, but your breathing keeps stopping. Your body panics. You switch to mouth breathing, hour after hour. By morning, your mouth is completely dry. But here's the real issue. Sleep apnea isn't just about dryness. It's linked to heart disease, stroke, and high blood pressure. Action. If you snore loudly, wake up tired, or have morning headaches, ask for a sleep study. Now let's talk about something most people miss. Your blood sugar. When glucose levels are high, your body pulls water to flush it out. You urinate more. You lose fluids, and your salivary glands, they slow down. The pattern is clear. Dry mouth plus thirst plus nighttime urination. That's a warning sign. Action. Ask for an HbA1c test. It shows your average blood sugar over 3 months. Here's something surprising. As you age, your thirst signal weakens. You can be dehydrated without feeling thirsty at all. So you drink less, your body runs low, and overnight you wake up completely dry. Your body stops warning you. Action. Drink on a schedule, not based on thirst. Start your day with 2 glasses of water. This one is less known, but very real. It's an autoimmune condition that attacks your moisture-producing glands. Dry mouth, dry eyes, difficulty swallowing, and it doesn't go away. This doesn't stabilize, it progresses. Action. If symptoms persist for months, ask your doctor about specific antibody testing. Here's where it gets serious. Most people don't have just one cause. They have 2, sometimes 3. This compounds fast. Action. Don't look for one cause. Look for patterns. Meds plus dehydration. Apnea plus high blood sugar. Dry mouth isn't just uncomfortable. Without saliva, bacteria grow faster, tooth decay increases, gums weaken. And over time, it can affect your entire body through inflammation. This spreads beyond your mouth. Action. Treat dry mouth early, not after damage begins. Fix the cause, not just the symptom. Before bed, small changes make a big difference. Avoid alcohol-based mouthwash. Use xylitol rinse. Stay hydrated during the day. And reduce caffeine late afternoon. Small habits, big impact. Try this routine for 7 days. Track the difference. Some symptoms should never be ignored. White patches, burning sensation, pain, or weight loss. These are not typical dry mouth signs. Short line. Don't wait on these. Action. Book an appointment immediately if they appear. Have you noticed something? Dry mouth always feels worst right after you wake up. That's not a coincidence. During sleep, your body naturally reduces saliva production. That's normal. But if you have one of the causes we discussed, that natural drop turns into a complete shutdown. You're starting the day at 0. Here's something rarely talked about. What you eat at night matters more than you think. High-salt dinners, processed foods. They pull water out of your system. So even if you drank enough earlier, your body enters the night already dehydrated. And by morning, you feel it. Action. Reduce salty foods at night. Focus on balanced, lighter dinners. Your dinner follows you into sleep. Not everyone with dry mouth has sleep apnea. Some people simply breathe through their mouth at night without realizing it. Nasal congestion, mild allergies, even sleeping position can cause it, and just a few hours can dry out your entire oral cavity. Short line, it happens silently. Action. Check if you wake up with a dry throat or bad breath. That's often a sign. This one surprises almost everyone. That fresh feeling from mouthwash, it might be making things worse. Many popular brands contain alcohol, and alcohol doesn't hydrate, it dries. You stripped it of moisture. Short line, fresh doesn't mean healthy. Action. Switch to alcohol-free or xylitol-based mouthwash. Most people try to fix dry mouth the same way. they drink more water, and yes, that helps, but only to a point. Because if the root cause is medication or blood sugar or gland dysfunction, water becomes a temporary fix, not a solution. Short line, hydration isn't the whole answer. Action, pair hydration with identifying the real cause. Here's something powerful. Instead of guessing, start observing. When does it happen? Worse after certain foods? Patterns reveal causes. And once you see the pattern, you stop guessing. Short line, data beats assumptions. Action, track your symptoms for 7 days. Look for trends. Let's simplify everything into one clear plan. For the next 7 days, drink water on a schedule. Adjust your routine. Avoid alcohol mouthwash. Pay attention to sleep. Review medications. 5 small steps. That's it. Avoid mouthwash. Pay attention to sleep. Review medications. 5 small steps. That's it. Short line. Simple works when it's consistent. Action. Commit to 7 days. Then evaluate how you feel. If you found this helpful, you need to watch the next video, where we break down sleep apnea and how it silently affects your heart after 60. Because that connection changes everything.